All right, well, good morning, everyone. I'm Katie Zezma. I'm a national correspondent for the Washington Post. I want to introduce my guests here. We have Mayor Marty Walsh of Boston and Mayor Joyce Craig of Manchester, New Hampshire. And our discussion today will focus on how local governments across New England are responding to the opioid crisis. And before we begin, I want to tell everyone in the audience, online and here, to tweet questions using the hashtag #PostLive. We'd love to hear what your questions are and what you'd like to hear from the mayors. So please send us what you'd like to know. So. Mayors, I want to start talking about, we have the statistics, right, that are happening. We have, about 60 deaths in Manchester in 2017, about 200 in Boston. Those are just the numbers. You're all on the street, and there's a lot more happening in your communities. How is this affecting your communities on the ground, and what do you see every day when you go out there?
It's heartbreaking. It's affecting everybody in our community. It has no boundaries, every neighborhood, socioeconomic, everybody. So it is, we're taking an all-inclusive approach. Everybody needs to be involved. We need to be on this and really start to make some significant progress in eliminating what's happening. One death is too many. And we're having way too many, and we're continuing to see the overdoses. So we need to take a community approach and bring everyone together to address this issue.
I've been working on this issue since 1997 when I got elected as a representative in the House of Representatives here in Massachusetts, and it's devastating. It's devastating when you know somebody personally that loses a loved one to addiction. It's devastating for the families that have loved ones that are in the grips of addiction. It's not a simple solution. As a mayor, I think as a human being, it bothers us all. And I think that, I know some folks put their loved ones' pictures up here, and you can't bring their loved ones back, and they know what the pain is. They know what the suffering is. They know what the stealing in the home is. They know what the not coming home at night is. They know if their loved one got into recovery. They know that happy feeling for a very short period of time, getting that good night's sleep when somebody goes into detox, and then when they break out again, that feeling of desperation, and you hope that the police arrest somebody just to get them off the street. That's what we're dealing with every day in the city of Boston. The numbers you said are 200 overdoses. I'd say they're probably higher than that. Mm-hmm. I think that people don't, nobody wants to have their loved one diagnosed as a cause of death and overdose. So it's probably higher than that, the number. But it's truly devastating. I see some folks here, Mayor Jajuga here. He's been doing this work as a state rep, as a senator, as a mayor. True, he can talk about his town. Frank Baker, city council from Dorchester. We can all talk about stories, but I think it's the mayor said it. It's a very sad, tragic part of our job that we have to deal with.
And the city of Boston has spent millions on recovery programs since you took office. You've opened the Office of City Outreach. There's the Engagement Center. Can you talk a little bit about what the goal is, what your goal is for the city of Boston?
Well, I think one of the first things, we created the first Office of Recovery Services in the country, in Boston, and that's really about looking at our system and looking at our services that we provide in the city of Boston. The way Massachusetts works is the state provides a lot of services through the Department of Public Health, the Bureau of Substance Abuse Services. As a city, we don't necessarily provide direct care, but we're supportive with the state on how do we make sure we get people, try and encourage people to go into detox. And one of the first things that we did as the mayor after we created that office, we realized that parents or people didn't have access into treatment, and they didn't know how to do that. I mean, it's not something that it's easy. You can pick up, Google and say, how do I get somebody into treatment? Right. It's not that simple.
Which I'm sure a lot of people were actually doing,
yeah,
because how else do you go about that?
So we made it as simple as possible. You pick up the phone and you call 311, and you ask the person on the phone that you want help or treatment for somebody, yourself or somebody else. And that's what we kind of have done in the city of Boston, trying to increase access to treatment. We work very closely with the state in making sure that we fund detox beds. We work closely with the nonprofits to make sure that we have halfway houses so we can have this continuum of care. But still, the task is daunting. I mean, not everyone who's an addict wants to get help, and so making that first call sometimes is difficult. I mean, for people to do, and so we try to encourage people. We have outreach workers in the street now. We have I think 5 or 6 people in different parts of the city of Boston trying to encourage people to get into treatment, or when they're ready to get into treatment, we're helping them with that. So what you can do is only provide the tools. The issue of addiction really started around 1850 when the pharmaceutical companies got together and started creating these pharmaceutical companies, and heroin started being produced. So we're talking about an issue that we've been grappling with for 160 years that we can't quite solve in 2 or 3 years or 4 or 5 years. It's going to take us time to get there. I think we have better services today than we had in the past, but you can't say that to a mother who lost their loved one last night because of addiction. It doesn't matter to that person.
And what you said is important. You know, people have to have the desire to go into treatment. They need to want to take that step, and it doesn't always happen the first time or the second time or the third time. How do your outreach workers kind of stay with those people and encourage
you keep
them
with
to
them?
do
I
it?
mean, you have no other. There's no other way of doing it. I mean, sometimes people will be fortunate enough to go to detox once and get it and never pick up again. And God love people that have that ability. Some people might go 15, 20, 30 times. I mean, people might say, "Oh my God, that's too many times." But eventually, I think there's hope for everybody. There's hope for, and I've seen people get into recovery that have been down, bottom, addicted to heroin and alcohol and other drugs, jail time, and they've completely turned their life around. I can tell you 2 cases of people that I know that own homes today, and there was no hope for them. So you can't give up. And as a city, as cities, we can't give up on anybody because that's our job and that's our responsibility as public officials. You can't give up on somebody.
And Mayor Craig, in New Hampshire, there has been a lack of treatment beds, and there have been a number of treatment facilities that have recently closed, not for lack of need, but because of financial problems. How has the lack of treatment beds in New Hampshire, made it more difficult for you as a mayor to try and get the constituents help?
Well, obviously, like Mayor Walsh said, we want to make sure that everyone can get the treatment that they need, and with the lack of beds, it's been a huge challenge. And when you talk about all of the programs you have in Massachusetts and all that you're doing and the money that you have, it makes me really understand and feel how far back Manchester and New Hampshire in general is. When I took office about a month and a half ago, we have a program called Safe Station. Every fire station is open, so anybody who needs help can walk in. There's no stigma. They can be they're comfortable in the environment that they're in, and we provide them with the help that they need. The treatment facility that helped people that went into Safe Station closed. And so we were in a situation where we needed to provide all of the programs to other entities and get things going, so we weren't at falling even further behind. But it also provided us an opportunity to say what's working and what's not. So we were able to really take a look at, we knew that people were coming in by the hundreds to our fire stations, but they were coming in for different reasons. Not always substance misuse, but homelessness, mental health issues. So we're able to bring other entities in and make them part of the solution. So we're really getting people to where they need to be. But it is an ongoing challenge that we don't have enough resources throughout the state. We're also seeing in Manchester, 65% of the people coming in to our fire stations are from outside of Manchester, in addition to outside of our state. So they know about this one access point, but we really need to do a better job of educating and opening up other access points throughout the state.
And so it was about 3,000 people use Safe Station in about 18 months, correct?
Yes.
And the city has partnered with Lyft to help people get from point A to point B. But there is an issue, right? Manchester, it's only for Manchester residents. Can you talk a little bit about that?
Well, what we've tried to do in looking at what's been working and what's not is we identified the significant a number of people who are coming into our city for help. So we've worked with the governor and the governor's office and other government agencies to really do a better job educating people throughout the state on where they can go in their area. So we're trying to and hoping that people really look to their neighborhoods and their cities and towns to get the help they need instead of coming to Manchester. That's where they're going to be the most successful, where they have the resources, hopefully the family, friends that can help them through this process instead of coming to a city they're not familiar with. So we're accepting anyone who comes in, but we really want to encourage people to stay in the areas where they live and get the help that they need.
Mm-hmm. And I know, Mayor Walsh, you've talked about a recovery campus in Boston. Can you tell a little bit how that would work?
Just for the people that are watching that aren't familiar with Massachusetts or Boston, we have a Long Island, which is part of Boston, which is off of connected to Quincy by a bridge. It's Boston's island connected to Quincy. And my first 8 months as mayor, within my first 8 months, I had to shut the bridge down because it was literally crumbling into the Atlantic Ocean. Out on that island, we had programs. We had a homeless facility. We had a couple of detoxes. We had about 3 or 4 long-term home recovery programs. So when we closed the island, we had to find a place for these programs to go. And when we did it, we replaced every bed on the island. But we realized now that we have an island, I made an announcement in January that we're going to rebuild the bridge back to the island and come up with a recovery campus idea. What does that mean? That means that we're sitting down now talking about what is the need in the recovery continuum of care. You know, detox beds, we have detox beds, we could always use more. We have holding beds. What we don't have is long-term recovery beds, really, enough in the Commonwealth to be able to sustain, get people into a continuum of care. So we're going to be looking at how do we create that type of long-term living environment out in Long Island. It's a perfect therapeutic setting. It's on the Atlantic Ocean. It's Boston. You can see Boston. You can see Quantum. You can see Quincy. It's an opportunity really to think about how do you create beds. The mayor was talking about Manchester. You know, when somebody wants to get sober, we have to get the whole state sober. So I think that you have to think of a system that works, not just Boston. You can't leave it up to the individual cities and towns in Massachusetts, for say. I'll use this as an example, to say Boston's only going to take care of Boston. You know, because when I got sober down in Gosnell, down the Cape. Mm-hmm. So I was able to go down there. So I think we have to think about how do you create a system that works. This recovery campus idea, you know, you might have people from all over the state there. I mean, you have to get out of the neighborhood you're in. You have to get out of the circumstances that you're in to get that clear head and get that opportunity to kind of to move your life forward. And that's really what I'm looking at here on Long Island. I've got a little pushback, maybe more a little pushback, but I've gotten some pushback. But I think once it's explained, people say, okay, I get it. Because everybody, and when I say this, I can say this today, everybody knows somebody who's either addicted, whether it's drugs or alcohol, or know somebody that has somebody in their family addicted. You couldn't make that same statement 20 years ago. Maybe you could, but it wasn't public. Today, it's more open, so people talk about it, and I think it's a better situation to be in as far as people talking about it, because then help can happen, but it's still a difficult situation.
And in terms of Long Island, you were criticized for taking the bridge down, and you know everyone did get into recovery, but it took a long time, and there was criticism that it added to people at Melnia Cass Boulevard. Did the situation
long term it didn't. I mean I think the people. Well, we do have a homeless facility on Melnia Cass now, so I guess that's there, but. I got criticized for not caring. I mean, Long Island is a place I went out to every other Sunday for literally almost 10 years, doing a commitment, an AA commitment at a program called Bridge to Recovery that changed the name after that. You know, and I went out there as a private citizen doing that. But you know, again, I guess you can make an argument that the bridge didn't get the proper attention it should have because it was addicts and alcoholics and homeless people on the island. Where if that was a bridge going to an island that had, you know, high-end condos and you know, other services, maybe the bridge would have been fixed. I mean, I'm just saying that, I guess. But you know, but what it made us do, it made us look. I mean, the opioid crisis isn't new. It didn't happen under my watch as mayor or the mayor's watch as mayor. It didn't happen in the last, you know, 10 years. This has been going on, as I said, for 100 years. But it's public now. Mm-hmm. And I think if we didn't have the abuse of the prescription drugs, we still might not be talking about this. But you know something? Even without the abuse of prescription drugs, we had a crisis. We had a drug crisis. We have people that were using and abusing drugs and heroin and crack and other drugs that came in that wasn't to the epic proportion it is today. And I think that, you know, I mean, we just got to continue to move forward. Any idea is a good idea. When you mentioned Lyft, you know, somebody may say, well, what's that do? Well, that gets somebody to treatment. That Lyft, one driver might get somebody to treatment that gets sober and turns their life around. I think any ideas are worth pursuing in this fight.
One idea that Lenny and the governor talked about are supervised injection facilities. They've been getting some traction in Philadelphia and in Seattle. They're illegal federally. Lenny went up to Canada and did a story on this. What do each of you think about the idea of supervised injection facilities?
I'll go first. I don't understand the concept behind it. To be quite honest with you, you know, I know that people say, well, we can watch and monitor. First of all, if you're a heroin addict and you go and buy your heroin wherever you buy it, you're probably not going to drive across town to the safe injection site to shoot up. And what happens, if anyone knows the history, if you pay attention to the history of the heroin dealership, heroin coming into the United States of America, when they were selling it on the streets of America, what they decided to do was find where the methadone clinics were. And when they found where the methadone clinics were, they realized these are the addicts. So now we're going to go and take the drugs over to the addicts and we can figure it out. And what happened was the addicts who were going to meth, they were sitting ducks. So you're going to tell me that we're going to have a safe injection site anywhere, and that the drug dealers aren't going to realize, oh, let's go over here. I mean, I've heard, I haven't seen firsthand, but a couple of people I know went up to Vancouver to see the safe injection site in Vancouver, and they said that block of area up there is a disaster. There's people shooting up in the streets. There's people shooting. There's drug dealing going on. I think it's an idea, I guess, but I just don't see the rationale behind it, because I'm an alcoholic. If you told me that I could drink safely in this bar and whatever happened, well, I want to be over here. And so I just get concerned about it. Philadelphia is just starting it. There's no proof. Nobody's come to me with scientific data saying they work, although somebody I'm sure will come up with scientific data shows that we've been able to save people at Narcan. I just don't see how that helps. I think you actually hurt the addict doing that, because now they're going to be preyed upon more by the drug dealers, because they know exactly where they are all day long. We do have a site in Boston, Healthcare for the Homeless has a room that people go into after they inject. They can go in and kind of hang out there. That's not an injection site, but it's kind of after you inject, you go in there. So I'm kind of curious to see how that's working out.
I was going to ask you about that. Yeah. I mean, do you agree with what they're doing?
Yeah. I mean, it's another thought process on how you do it. We'll see what happens. But I just think the safe injection sites is going to cause a whole bunch of new issues.
In New Hampshire, we're so far away from this. We don't even have needle exchange. We don't have a safe site like you talked about. We are so far back that I think there are things that we need to do to even, before we even consider something like that.
People are afraid of the needle injection sites and needle exchange. And I mean, when I was a legislator, for a little while it was a tough issue, but then it's really not. And then buying needles and training needles in, it's really not that big of a deal. Meaning that you have, if that can cut down on disease, exactly. That's the positive way to do it, and not sharing needles. And I think that people, in New Hampshire or anywhere in the country, I mean, unless you hide in your house, I mean, look outside. There's heroin on your street, and there are people that you love doing it. And I think if you can preserve them with some other potential health risks down the road, we should try and do that.
Absolutely agree.
And would you like to open one in Manchester? I know there is one in Claremont, New Hampshire, that just closed because it was too close to a school with zoning.
It is something that we've talked about in Manchester, so we are looking at it.
You talk about schools. I think that we have to do more intervention in our schools earlier. I think, a lot of people say, oh, it's next to a school. Well, there's a good chance in that school there's kids using drugs. And I think that we have to do is get to our kids younger in grammar school as early as grades 3, 4, and 5, and start talking about addiction. And people might say, oh, it's too young. Well, by 7th, 8th grade, they're smoking weed.
What do you tell them?
So I think you have to explain what an addiction is. And I think you have to talk about situations. And I think that, unfortunately, a lot of schools now, I mean, Chris Herron talks about growing up in Fall River, Massachusetts. He was the top scorer. He's still the top scorer all time in Massachusetts. He partied with his friends. He went to college. He did coke and oxys, and it took him on an incredible ride that nearly ruined his life, or ruined one part of his life as far as his professional career, but didn't ruin his life because he's come back as a stronger human being because of recovery. But I think you have to tell those stories. I mean, people need to know that these are real, because a lot of people see stuff on the street. The kids observe. Kids know in the neighborhoods who's doing the drugs, who's drinking the booze, who's hanging in the corner, who's doing it. They know that. So if we think they don't know, we're crazy.
And their parents are doing it. And that's what we're seeing in Manchester. We need to really help these kids through this difficult time that they're having at home. So when they're at school, it's a safe place for them, so we can help them through this. And we have to do more. I completely agree with you.
It's affected the foster care programs. It's touching children as well as adults all over. Mayor Walsh, you had talked about potentially joining the lawsuits against the pharmaceutical companies. Yep. Where are you on that?
We're right now. We put an RFI out. We're getting what the legal community is doing. We're going to make a decision really soon. We're probably going to join the lawsuit. We're looking, though. There's a couple different things going on. There's an investigation going on by the attorney generals, 40 around the country. Ours being one. Maura Healey is looking at how they're going to proceed forward. You have individual states that have sued pharmaceutical companies, and you have a kind of a class action lawsuit with cities around America. So we're looking at the best approach for us to move forward on how we do it. I think, suing, okay, we're going to sue and maybe get some something back from all the devastation that these drugs have cost us. But I think the suit is really about raising awareness and continuing. For me personally, it's about continuing the conversation and having people pay attention to what's going on. I don't think people really paid full attention to the smoking until they got sued. And when they got sued in different states, won those awards, people started paying really attention to what came out of that.
And do you kind of view this as like the second wave of the tobacco type lawsuits?
I think I guess you can say that. I think that tobacco is devastating, but I think heroin and prescription drugs are more devastating. And I think that, I heard the governor talk right before me, and he was talking about prescribing in certain prescriptions, and he's done a really good job legislatively with the legislature doing some great things. But if you go in for kidney stones or what have you, I mean, if I ask my doctor tomorrow, I want a prescription of oxycodone or oxycontin because I have a bad pain in my back, they're going to give it to me. Do I need 30 prescriptions for kidney stones? I mean, the pain lasts for 12 hours, and so I think that we have to think differently about how we do things in this country.
Mayor Craig, I know you just took office, but is the lawsuit something that you had considered or thought about?
Actually, the city signed on prior to me taking office, so we are participating.
And Mayor Walsh, I'm talking about the engagement center as well, which has been set up in the South End. Can you talk a little bit about that and what it offers?
Yeah, our engagement center. So when we had to close Long Island Bridge, we had to move our homeless facility off of Long Island. It made us really think about homelessness in Boston a little differently. And we literally had a building that was a transportation shop, sign shop. We moved out the sign folks out of there from transportation. We renovated the building, and we built not a state-of-the-art, but a brand new homeless shelter in the city of Boston. Not every homeless person goes into shelter at night. A lot of people will want to stay on the street. They just won't come in. They won't engage. So we decided around Melania Cass Boulevard and Mass Ave, we had a lot of people homeless. Not all homeless. Everyone down there I think everyone describes them as homeless, but they're not all homeless. Some are just come down for the day and hang out, cause a lot of havoc, and go back to wherever they come from. But what we decided to do was create a drop-in place for homeless folks that want to hang out for the day and be safe. Not hang in the street, not sleep under a bridge, not hang under a tree, but come to a place that will provide them with a cup of coffee, some breakfast in the morning, some lunch, something at night, and then kind of get off the street and kind of let them do what they want to do while they're there, but get them off the street. So we opened this engagement center. It was temporary at first. It's still temporary for now, and we're going to think about doing long term. And I think we've had in 6 months, about 27,000 visits in the engagement center. That means repeat people coming in. And what we're finding is, I think we've got about, Brendan, like 60 people into recovery. So we have like 60, 70 people in recovery that were homeless that came into the engagement center, and indirectly we're working with them to counsel them, to give them some ideas about maybe if you want to go for help, you can go for help. So what it is, it's a drop-in center for homeless people. And so people aren't seeing the homeless folks in the street, but we're also not hiding the homeless people by we're trying to engage them with opportunities for recovery. And I think that it's worked to a degree. And in Boston, in the last 3 years, actually 3.5 years, we've housed over 1,300 chronically homeless people that were on the streets of Boston that are now in a home in around the Boston area. So we're trying to be creative on homelessness. And I just want to be clear, homelessness and addiction are two different things. Sometimes they're the same, and sometimes they're different. So when I was in recovery, when I went to detox, they asked us to describe a homeless person. And what we said was a person drinking a bottle out of a brown paper bag. And I think it's important for us as a society to realize that not all homeless people are addicts, and not all addicts are homeless people.
And when you closed Long Island, and it took a while to get people into recovery, did that really show you the difficulties of placing, just the lack of beds, the lack of treatment, the fact that it took so long?
One thing we had a first of all, the programs were surprised because they're running, and the next day they're all nonprofits. Most of them are nonprofits. They have no place to go. So we're trying to find places to site. And citing a program is very difficult. And it's unfortunate because a couple of programs we tried to cite in different areas, and people didn't want them in the neighborhood. And I said to myself, them are those neighborhoods. I mean, and it's really discouraging when you want to put programs in, a good, strong program I'm talking about, in a neighborhood that doesn't want it, especially after you explain it. I mean, we had a difficult time placing one of the detoxes that was actually pretty much a lockdown detox, meaning that there's no drug activity going on around the detox. You go there, you go in for treatment, they shut the door, they lock the door, they don't let anyone in. You're going to visit certain times of the week. You can't visit all day. So it is difficult. And I think that citing these programs is complicated and difficult. And I think some neighborhoods open their arms, but it's hard. And I think that people need to realize that, again, as we cite these programs, I mean, somebody might say to me, well, you wouldn't want on your street. Well, you know, I lived in Savin Hill, and there was a house down the street called, that was for chronically homeless people, and I brought Pine Street in there. And they run a great program. It's a single room occupancy home with common living space that there's no problems on. So, I mean, people need dignity. And I think if we show people respect and dignity, and if a neighborhood can do that, it'll be helpful.
Mayor Craig, have you run into some of those issues in Manchester as well? You know, the need for facilities and just the lack of desire for them in certain neighborhoods?
We absolutely have. And right now we're dealing with the safe and sober homes and finding places to do that. There really are no rules or regulations about it. And, you know, things are popping up throughout the city, not necessarily safe for all people. So we're trying to, you know, our firefighters, our police officers are doing amazing work on the streets right now, battling this crisis, but also trying to make sure that people are safe and where they need to be so that they can get the help that they so desperately need.
And in my opinion, there's a big difference between a licensed recovery home by the state and a sober home that's opened by somebody who is in recovery that's renting it out for, in some cases, top dollar,
right,
and not having proper programming because they can't regulate their clients that are in there. But a halfway house in Massachusetts, by definition, they can be drug tested, and if they fail, they can be asked to leave.
And how do you root those out, you know, if they're just popping up?
It's hard. I mean, I've worked with the state before I was in this role as a rep, trying to figure it out, and a lot of it is regulation and trying to come up with zoning regulation in the community, and it's difficult. And I think that a lot of the bad players in that industry, at least in Boston, are starting to. I think they're deciding this is too much for us because Boston's a small town, and it's not that complicated to find out who these people are and kind of go right to the heart of it.
And get right in there. We only have about 3 minutes left, but I know Mayor Walsh, you went down to Miami to the mayor's conference and were showing people how to use Narcan. Can you talk a little bit about that and what both of your plans are for Narcan and what it's doing?
You know, Narcan's an incredible creation, I guess, invention, but it's temporary and it's short. We did a demonstration for the mayors around the country, show them what Narcan is, because a lot of people are afraid of Narcan as well. And when I became the mayor, I asked my police and fire to all carry Narcan. Now everyone has it. It's important what Narcan does. It helps potentially prevent an overdose death. It's short term. It's saved people's lives. But unless we have the next step after the Narcan, we're back in the same situation again, meaning that when you hit somebody with Narcan and they come back, more often than not, they're not willing to go into treatment that minute. They don't even realize they had an overdose. They literally died. But Narcan allows parents to have a second shot at their kids. Narcan allows people that are in the grips of addiction to have a second shot at life. And I think that it's one of those things that I promote it, and I try and get it, try to tell people as best you can, get trained in it, because you never know. You never know the person that you give administer the Narcan to, that person might go into treatment the next week and get sober and have an incredible life. So that's the beauty of Narcan, or any type of block. But I do think that we have to, one thing I'm concerned about is on treatment side is going too much, we're going way too far into medically treated addiction.
How so?
There's just too much. I mean, we're talking about it in the country. We're talking about it in the cities and towns and the states. It's just way too much. I agree with using methadone and other things to help you come off the drugs, but not long term. We're going to make pharmaceutical companies rich by allowing them to create drugs to treat the people that they created drugs that got them addicted.
What are your thoughts on medicated assisted treatment?
I agree. We have a methadone clinic right next to City Hall, and when I go to work every day, I see, on Mondays, the same people going in and coming out and going in and coming out. And, we really, in New Hampshire, we need some regulation. We don't have it, and we need to see what they're doing and make sure this is supposed to help them, and we're supposed to be weaning them off, but they're becoming addicted to these these drugs, and it's a problem.
And there are also people going in there that you don't see, that,
Right.
that are getting treated. But I just get worried that every time we think that we're going to fix the issues by putting more medicine. I mean, in Massachusetts, this happened when I was a rep. We started forcing halfway houses to take people on medical. If they were on Suboxone or other drugs, they forced them to take it. That's wrong. I mean, you have bureaucrats making decisions that don't understand the addiction, and you're telling people how to change a system. And I have a real problem with that.
So I feel like we could talk about this for another half an hour, but unfortunately this is all the time we have for this one. But thank you so much for joining us, and we will move on to the next part of our program now. Thank you. All right, thank you very much.